Hi, I'm Dr. Jeff Forzley with Lemont Natural Healthcare. Today we're going to talk about thyroid conditions and about our unique comprehensive thyroid recovery program. I'm Dr. Jeff Forzley. There are two other doctors in our clinic, Dr. Mark Long and Dr. Matthew Imber. We are chiropractic physicians and holistic practitioners. 100% of our practice now is holistic medicine. Together, we have 52 years of combined experience doing healthcare. I am board certified in integrative medicine. Dr. Mark Long is a diplomate in the American Association of Integrative Medicine, and Dr. Imber is board eligible as a diplomate in functional neurology. Our overall goals are to provide symptom relief by finding and balancing the underlying causes of your thyroid condition. We're going to use natural therapies that work with your body and do not have side effects like medications. We want to help you live a better quality and a longer life. Now, thyroid hormone functions. Thyroid hormone is the master metabolism hormone. So when your metabolism is high because the hormone levels are too high, you're going to get symptoms of hyperthyroidism. And just think of your whole system as into high gear. When you have low thyroid symptoms, then your metabolism slows. So brain function slows, gut function slows, your body temperature slows, and we're going to talk about symptoms in just a minute here. Thyroid symptoms are due to the fact that there are receptors in every cell in your body that accept thyroid hormone, and it utilizes it for metabolism. There's three major thyroid conditions. There's hypothyroidism, where the thyroid hormone levels are low. There's Graves' disease, or hyperthyroidism, where the thyroid hormone levels are high. And then there's Hashimoto's disease, which is where you have symptoms of highs and lows, different periods of time where the hormone levels are high and other periods when the hormone levels are low. Now, common hypo or low thyroid symptoms include fatigue, sometimes extreme fatigue, weight gain, poor memory, brain fog, poor mental focus, morning headaches, poor digestion. So think of everything slowing down. You get constipation, indigestion. You're not breaking down your food properly. Depression and mood swings can occur. Overly sensitive to cold weather because your body temperature slows. Your hands and feet can be cold. Poor circulation, muscle cramps, a poor immune system, so you get colds and flus frequently. Insomnia, or requiring an extra amount of sleep, or a hallmark sign is you wake up in the morning and you just can't get out of bed. You're exhausted and you have to push yourself to get out of bed. Itchy, dry skin, and thinning hair. Now, hyperthyroidism, or Graves' disease, is a high level of thyroid hormone in the body. The thyroid gland is producing too much of this hormone, and since it controls metabolism, your whole metabolism is going 100 miles an hour. You get heart palpitations, you feel inner trembling, you can get an increased pulse rate, your heart is racing, you can feel very emotional, you can get insomnia, night sweats, difficulty gaining weight because your metabolism is very high, and you can get what's called exophthalmos, or protrusion of the eyes. Now, Hashimoto's is a condition where we're combining these symptoms. So you might go a few weeks or a few months of high symptoms, or a few weeks or a few months of low symptoms. Most of the time, you're going to have symptoms of low thyroid when it comes to Hashimoto's. Now, every cell in your body, as I mentioned, has thyroid receptors, so it's going to utilize thyroid hormone. And thus, when you have a thyroid condition, your whole body feels out of balance. It all starts with the brain. So the unique thing about what we do here is called Neuro-Metabolic therapy. So we mentioned that Dr. Imber is board eligible as a diplomate in neurology, or functional neurology. Everything starts in the brain when it comes to the thyroid. And all of my patients that have come in that have a thyroid condition, their brain has never been addressed, and we will do that for you. So The hypothalamus is part of the brain, the midbrain, and there's a part of the hypothalamus called the periventricular nuclei, or the PVN, and it actually starts with serotonin. Serotonin is a neurotransmitter, and serotonin is involved with mood. When it's low, you get depression. Serotonin will stimulate the PVN in the hypothalamus, and then the hypothalamus is going to stimulate the pituitary gland, which is inside the brain, via the TRH, or thyroid releasing hormone. So this is a chemical from the hypothalamus to stimulate the pituitary gland. Now the pituitary gland is going to control all the glands in the body that release hormones. We're going to start with thyroid. So the pituitary releases TSH, or thyroid stimulating hormone, and TSH is a common test that's done. I'm sure your thyroid patients have had that. You're familiar with that. And it's going to stimulate the thyroid gland to make thyroid hormone. The thyroid makes two different kinds of thyroid hormone. It makes T3 and T4. T4 is the majority of what it makes. It makes 93% T4. Now, T4 is the inactive form of thyroid hormone. It does not act on your metabolism. It has to be converted to T3, which is the active form, and that's what controls your metabolism. So, it makes 93% T4. It has to be converted to T3. 80% of this conversion occurs in your digestive system and your liver. So we have to have a proper functioning digestive system and liver in order to make and convert the active thyroid hormone. TBG is called thyroid binding globulin, and what it is it's like a taxi cab, and it binds to the thyroid hormone in the blood, and it transports it to what we call a receptor site, or like a docking station, and that's where your thyroid hormone is absorbed into the body after the protein releases it in the blood. So again, we have conversion, 60% in the liver, 20% in the gut or the digestive system, and 20% is going to go to peripheral tissues or go into an unusable stored form. Again, the free T3 is what gets absorbed into the cell. The pituitary also controls the pancreas for blood sugar balancing. Also, the pancreas releases enzymes to break down carbohydrates. The pituitary controls the adrenal glands, your stress response. It also controls the ovaries and testes for estrogen, testosterone, and the sex hormones. The other point is that all these glands actually communicate chemically with each other. So if you have a thyroid problem and an adrenal or a blood sugar problem, it's going to be very difficult to just treat one without balancing all of them. That's what holistic therapy is, looking at all the systems of the body and how they interact together and balancing them naturally. There's 8 major thyroid patterns. There's 24 patterns overall, but 8 major patterns. We don't know how to treat you or manage your condition until we know which of these patterns you fit into. Once we do the proper testing, then we'll know what patterns you fit into. Then we're going to know how to treat you and get you better. Hypothyroidism, low levels. Hyperthyroidism, high levels. Hypothyroidism due to a bad pituitary. Thyroid overconversion, converting too much of T4 to T3, and this is going to cause what's called thyroid resistance. Decreased thyroid binding globulin. If you don't have enough of the proteins to transport the thyroid in the blood, it won't get to the receptor site. Elevated thyroid binding globulin. These again are the proteins. This is due to birth control pill use or estrogen therapy. Thyroid resistance due to inflammatory cells, what are called cytokines. Cortisol, the stress response. Cortisol is a stress hormone, and you can actually have essentially normal labs and find this thyroid resistance pattern. And last is the autoimmune thyroid. Now, let's talk about autoimmune thyroid. Hashimoto's and Graves' disease are autoimmune diseases. They're primary autoimmune, meaning your primary problem is not your thyroid, it's your immune system. There are autoimmune conditions. This means that your immune system, instead of protecting you, viruses, parasites, bacteria, it's attacking you, and it's attacking your thyroid, so it's breaking down your thyroid tissue. If you have autoimmune Hashimotos or Graves and you do not address your immune system, you may never get better. So we have to address these. This is what holistic therapy does. Why would your immune system attack you instead of just protecting you? Two reasons: dysregulation, or what we call active antigens. Dysregulation is chronic inflammation. This is a very common thing that's associated with many chronic conditions. Blood sugar imbalances, adrenal gland imbalances due to stress. Everybody's under stress. We're not responding to that properly. Other hormone imbalances, neurological imbalances, and poor digestion. Antigens include any chronic infections, bacterial, viral, yeast, these parasites that are in our digestive system. These are going to run down the immune system. Food allergies, especially gluten sensitivity. In the past 15 years, the incidence of gluten sensitivity is skyrocketing. Gluten, by the way, the gluten sensitivity, which is gluten is the protein portion of grains, especially wheat, rye, and barley, it is highly associated with thyroid conditions and environmental toxins. We are bombarded with toxins. Throughout our lifetime, we're exposed to thousands and thousands of toxins that do us absolutely no good except running our immune system down. Now, autoimmune, the big picture. If you are autoimmune against one tissue, let's say you have autoimmune thyroid disease, and you do not get to the cause of the problem and balance that, number one, your thyroid is not going to improve, or very little, and number two, your immune system can start attacking other parts of your body. You can develop second or third different types of autoimmune diseases. We're going to compare autoimmune to a light dimmer switch. So we take the dimmer switch, we go click, the lights come on. As we turn it up, the lights get brighter and brighter. It's the same type of thing with autoimmune. Once you're diagnosed with an autoimmune disease and your immune system is very weak, you can't be cured. I can't cure you. Medical doctors can't cure you. It's a matter of managing your condition at this point, managing it the rest of your life. So as the immune system gets weaker and weaker, just like the lights getting brighter and brighter, your health is going to deteriorate. Our goal is to tone that down, balance the immune system, and you're going to feel better and live a lot longer. Autoimmune diseases: lupus, rheumatoid arthritis, scleroderma, Crohn's, celiac disease, Lou Gehrig's or ALS, MS, Sjogren's, ankylosing spondylitis, type 1 diabetes, ulcerative colitis, vasculitis, Raynaud's, eczema, Guillain-Barré syndrome, myasthenia gravis, psoriasis, and Hashimoto's and Graves' disease. It just depends on the tissue of your body that your immune system is attacking. We just put a name on it. Autoimmune disease, medical treatment. Medical treatment is designed to lower the immune system. They're called immunosuppressant drugs like Enbrel, Remicade, Humira. And what they do is they suppress or shut down your immune system. And the theory is that then your immune system is so weak it can't attack your thyroid. And that's true. You might feel a little bit better at first, but if you have no immune system and it's totally suppressed or partially suppressed, you're going to get sick, you're going to get frequent colds, flus, you're going to get many different conditions, and you can get cancer. And the drug companies even tell you this. Autoimmune means it leads to tissue destruction. Your immune system is attacking a certain tissue and it's breaking it down, and that tissue then cannot function. There was a study done in Milan, and what they wanted to do was find out, why did people live to be 100 years of age? So they tested all these 100-year-old people, they interviewed them, did tests, and they looked at genetics, they looked at their life. Were they happy? Did they eat well? Did they exercise? Did they excessively smoke or drink? All these factors. The number one factor was none of these people had an autoimmune disease. So if you have autoimmune thyroid, you need to get your immune system under control so you feel better and you can live a longer life. Intestinal permeability or leaky gut syndrome. This is the prerequisite. This happens first and then it leads to an autoimmune reaction. What happens is the lining of the gut starts to break down due to toxins. High stress releases cortisol. Cortisol can destroy the lining of the gut as well as brain cells, and you get this permeability where toxins now, instead of staying in the digestive system, are leaked into the bloodstream, and your immune system does not like this. It has a reaction, and after a period of time, weeks, months, years of this happening, your immune system weakens and it can actually turn into an autoimmune reaction. 80% of your immune system is in your gut. It's a barrier, so it's going to keep the toxins in the gut. So leaky gut means you're leaking those toxins into the blood. Also, part of this 80% of the immune system in the gut is your good bacteria or probiotics. Leaky gut syndrome, again, is a degeneration of the lining of the gut, and it increases that permeability. Now, with leaky gut, and even without it, you can have gut inflammation. Inflammation leads to what are called cytokines or inflammatory cells. Cytokines can further cause the leaky gut to get worse. The cytokines can also go into the bloodstream. They can travel to the brain. They cross the blood-brain barrier. They react with your brain immune cells called microglia, and these glial cells then become inflamed. It causes inflammation in the brain. The brain does not function properly. The brain controls every function in your body, including controlling your thyroid, your immune system, and your digestive system. Again, you see how holistic therapy is the best way to manage these conditions, these thyroid conditions, because we're going to look at all these different scenarios. Now let's talk about the nervous system. The brain makes up 3% of your body weight, but it takes 20 to 30% of your body's metabolism. Metabolism is blood sugar, oxygen, so the brain needs all this to be balanced. So if you have anemia, you have blood sugar issues, it's going to decrease the function of your brain, and then your brain cannot control your thyroid properly. So what we are going to do is, again, manage you neurologically, because the brain controls everything, including your thyroid, and metabolically, which is directly working with hormones, the digestive system, your immune system, and the diet, what you should or should not eat. Again, what makes us unique is we do more extensive lab testing to find the underlying causes of your condition. We address the underlying cause of an autoimmune imbalance. We have to look at the immune system, and our patients are managed with neurologically and metabolically, and we use natural therapies to balance your body. Natural therapies do not have side effects when done properly. These are all the lab tests that we can order from you. This is a comprehensive list. We want to be comprehensive. We want to find out what's wrong with you right away. Most of my patients coming in are very sick. They've been sick for many years, for a long time, and they don't want to just do one test, get some therapy 6 months, and wait. We want to do all these tests, as many as these that apply to you, and find out everything that's wrong right away. So a complete 10-panel thyroid test. This is really important. Not just TSH, T3, or T4. There's a 10-panel test. Why do we do this? Remember the 8 major thyroid patterns. We need to know what patterns you fit into. This test is going to tell us that. A complete metabolic profile. We need to know if you're anemic, blood sugar is out of balance. I just told you how that controls the brain function. We're going to look at cholesterol, vitamin D, inflammatory markers, digestive markers. There's 49 tests in all in our chem panel. The standard chem panel is 24 tests. We're going to do a test for intestinal permeability or leaky gut syndrome. If you have it, it must be addressed and managed and healed, or your immune system will continue to be stressed. We're going to look at the immune system. We're going to test that, the adrenals. We're going to test your stress glands. We're going to do a microbial stool analysis. any bacteria, yeast, parasites, any kind of infections in the gut are going to run your immune system down. We're going to test you for food sensitivities, including gluten. We can test you for heavy metal toxicity. Heavy metals like mercury, lead, and aluminum can weaken the immune system, and they can actually destroy brain cells. Organic acid tests. This tells us all the nutrients involved in making energy in your body. Thyroid patients can be completely fatigued because of a low thyroid hormone levels, but also because they're missing nutrients that make energy in the body. We take food and we need all these nutrients to make energy. These nutrients include B vitamins, magnesium, manganese, iron, NADH, CoQ10. There's a whole list of these. This test will test those. And also we're going to look at nutrients like iodine, tyrosine. Thyroid hormone is made by combining iodine and tyrosine. We're also going to look at other nutrients like selenium. So, our neurometabolic program. Neurologically, we need to balance the brain. The frontal, the temporal, the parietal, occipital lobe, the cerebellum, which is your balance and posture, and then the midbrain, the hypothalamus, which is what directly controls your thyroid. Do we need to look at this? If you want optimal relief, we need to do a neurological evaluation, and we need to balance whatever's out of balance. Metabolically, we're going to look at hormones and not just thyroid. We're going to look at insulin, blood sugar. We're going to look at cortisol and DHEA, your stress hormones. We're going to look at estrogen, testosterone, progesterone, because all these hormones, like I said, interact together. And for example, if your cortisol is out of balance, it's very difficult for your thyroid to heal because your cortisol is the priority in the body. It's the survival hormone. So your body's going to prioritize that, so your thyroid may not heal if your cortisol is out of balance. We're going to look at diet, what you should or should not eat based on lab tests. You might have food allergies or sensitivities. And we're going to use what are called nutraceuticals, nutritional supplements to heal the gut, balance the immune system, decrease inflammation, detoxify the gut, detoxify the liver, the kidneys, provide nutrients you are deficient in. This is our entire holistic program. Now, the medical treatment for thyroid involves multiple different types of modalities depending on what's wrong with you and what your tests show. Hormone replacement. If thyroid hormone levels are low, you're going to get thyroid hormone. So Synthroid and levothyroxine are synthetic T4 only. Remember, T4 is the inactive form of thyroid hormone. It has to be converted to T3, so if you have a bad gut, bad liver, you can take all the levo or synthroid you want, you may not have an improvement in your symptoms. And how many times I get people coming in and they're like, I'm on the medication and I'm not feeling any better. This is why. Cytomel is synthetic T3. And remember, I'm using the word synthetic. It's not bioidentical exactly what's in the body. Armour Thyroid and Nature Thyroid are bioidentical. They work better in the body, and Armour Thyroid and Nature Thyroid are T3 and T4 combined. Now, other treatments are immunosuppressants like Enbrel, Remicade, Humira, prednisone. These again just suppress and decrease the immune system. They weaken it and make you prone to infections. Methimazole is a medication that's commonly used for Graves' disease. Methimazole will actually prevent the production of thyroid hormone. And this is necessary if you have Graves' disease, because if you have Graves and there's too much thyroid hormone, then you can get what's called a cardiac storm. And then you get an increase in the heart rate. If it's too high, you can get a stroke, and there's all kinds of things that we would rather avoid. So sometimes if you have Graves, you do need this, but if we balance the immune system, take the pressure off, the attack off of your thyroid calms down, and we can talk about lowering that medication through your medical doctor. And then surgery. They can actually remove, if you have nodules, they can remove nodules, partial thyroid, and sometimes if you have cancer or too many nodules, they might remove your entire thyroid. Now, overall medical treatment, Sometimes these are absolutely necessary. And sometimes with our program, we can improve the immune system and the function of the thyroid, and you can get off your medication through your medical doctor, not us. And also some patients just lower their medicine, but they still need some medication. Thyroid factors. This is what our job is. This is to look at all these factors to be as comprehensive and detailed as possible so you get optimal results. We're going to look at the brain and the hypothalamus, why it directly controls your thyroid, your immune system, your digestive system. We're going to look at the pituitary gland. It directly controls your thyroid. We're going to look at hormone interactions like we already talked about, cortisol, testosterone, insulin. We're going to look at your immune system. We're going to look to see if you have chronic infections, whether it's parasites, bacteria, viral, digestive system, leaky gut. We're going to look at dysbiosis, which is not enough good bacteria or the probiotics. Diet, food allergies, gluten sensitivity. Goitrogens are certain foods that interfere with the production of thyroid hormone. You need to eliminate these. Tyrosine, iodine, vitamin D, calcium, magnesium, glutathione, which is the strongest antioxidant in the body, selenium, neurotransmitters. Remember I said serotonin starts the whole process. It stimulates the paraventricular nuclei in the hypothalamus to stimulate the pituitary gland. Toxins. We're going to look at your liver. We're going to look at medications. Some other medications you're on, not thyroid but other ones, can interfere with thyroid production. Side effects of those medications. We're going to look at birth control pill. It affects the thyroid binding globulin or the transport protein for thyroid hormone. And inflammation in the gut, inflammation in the brain, it decreases all these functions. This is holistic therapy looking at all these factors. Summary. There's 8 major thyroid patterns. We need to know what patterns you fit into in order to get you better. We need the 10-panel thyroid test. Proper testing, we have to find the underlying causes of your thyroid condition. Autoimmunity. Up to 80 to 90% of all thyroid conditions are autoimmune. So the majority are autoimmune. You must find the cause of your immune imbalance. The immune system will progressively do tissue destruction, and also it can move on to other tissues in your body. We have to address leaky gut, your digestive system. We're going to address you metabolically, neurologically, and you're most likely watching this because you have an unresolved thyroid condition. You either have the symptoms, are undiagnosed, or you're taking medication and you're not getting results. So we not only look at the thyroid, but we're also going to look at all these other factors. If we feel that we can help you and you decide to join our program, you must be willing to make some lifestyle changes, including changing and improving your diet. Now, your insurance company may pay for your lab tests, but they do not pay for holistic therapy. 99% of the U.S. government health sector budget is for treating illness, not preventing it. Our healthcare system and our insurance companies are pharmaceutically driven. They have no interest in prevention. The United States makes up 5% of the world's population, but we consume 50% of the pharmaceutical drugs, and we're ranked 37th in overall health. Something is wrong with this system. There are billions of dollars spent every year on medical and pharmaceutical research, yet chronic health conditions like cancer, heart disease, stroke, diabetes, autoimmune diseases like MS, lupus, rheumatoid arthritis, thyroid conditions, Graves, Hashimotos, hypothyroid, obesity is on the rise, autism, attention deficit, all these conditions are on the rise. What I'd like you to do is take the next 10 seconds and I want you to think off the top of your head what 3 things you can do to improve your health right now. Okay, when I ask my patients these questions, I get answers like improve my diet, exercise, get better sleep, lower my stress, quit smoking. What answers did you give? I doubt that any of these answers are take more medications. If your thyroid condition is causing a major negative impact on your health and your current treatment is not working, I want you to know there is hope. Give us a call at 630-257-0550. I look forward to meeting you and helping you. Thank you.